When learning the muscles of the forearm, you want to think about them in the anterior and posterior compartments. This is the anterior side of the arm, and the muscles that I'm going to point out first all originate from the medial epicondyle of the humerus. So I'm going to start with the pronator teres. That's right here, and this pronates the arm. Next, this is the flexor carpi radialis. It inserts on the radius and in the metacarpals. Next is the palmaris longus. That's right here, and that inserts on the palmar surface. This right here is the flexor carpi ulnaris, and that also inserts on the metacarpals. Next is the intermediate layer, and this is the flexor digitorum superficialis. That inserts on the digits. Directly below that is the flexor digitorum profundus, and that's in the deep layer and also inserts on the digits.
Two other muscles that are located in the deep compartment of the anterior forearm. One is the flexor pollicis longus, and that is right here. That muscle inserts onto the base of the distal phalanx in the thumb, and it is responsible for flexing the thumb and the forearm weakly. There is also a deep pronator located in the distal forearm called the pronator quadratus, and that muscle, as you can guess, is responsible for pronating the arm. Next, we'll talk about the arterial supply to the forearm. So these two arteries are the radial artery and the ulnar artery, and they are two branches of the brachial artery, which isn't shown here. The ulnar artery also has a branch that is located up near the elbow joint called the common interosseous artery, and you can't see it here because it runs deep to the interosseous membrane. So these two arteries come down to the palm and they form the deep and superficial arches, which is a network of arteries in the hand. And lastly, I'll point out the nerves in the forearm. This nerve here is the radial nerve.
Goes a little bit lower.
This nerve here is the median nerve.
Actually, as well.
This nerve is responsible for innervating the majority of the forearm flexors and a few hand muscles. And as you can see, it runs right through the carpal tunnel, so we cut the transverse carpal ligament. But a clinical aspect for this nerve is carpal tunnel syndrome. So when all these tendons from overuse get inflamed, the inflammation can actually pinch on this nerve, and you can have some nerve issues. And lastly, there is the ulnar nerve. And as we learned, that nerve is responsible for innervating the majority of the hand muscles, like the dorsal and palmar interossea. And lastly, one more clinical aspect to our presentation is medial epicondylitis, which is sometimes called golfer's elbow, and that is inflammation of the origin of your flexor muscles.
Okay, so this is the posterior compartment of the forearm, or the dorsal part. Most of these originate on the lateral epicondyle of the humerus and are innervated by the radial nerve. This first is the brachioradialis right here. And this developmentally is an extensor, as most of these are. However, functionally it is a flexor. So this is the brachioradialis. And the reason why developmentally it's an extensor is because it's innervated by the radial nerve, which is right here. And next to that is the radial artery, which you can see here. Here is the extensor carpi radialis longus, and this inserts on the base of the second metacarpal. This is the extensor carpi radialis brevis, which inserts on the base of the third metacarpal. This is the abductor pollicis longus, and this is the extensor pollicis brevis. This is the extensor digitorum, which inserts on the base of metacarpals 2 through 5. This is the extensor digiti minimi, and it inserts on the 5th metacarpal. And this is the extensor carpi ulnaris, which also inserts on the 5th metacarpal.
Moving on to the deeper portions of the posterior compartment of the forearm. Here, deep to digitorum, you see the supinator, which is responsible for supination of the forearm. Here you see extensor pollicis longus, which is responsible for extension of the first digit. Here you see extensor indices, which actually goes to the index finger, and when you pull on the tendon, you can actually see the muscle tighten, which is helpful. Here's the extensor retinaculum, which is thick connective tissue that holds all the tendons close to the wrist. Here you can see the extensor hoods, which a lot of the tendons will actually attach to and are responsible for assisting with extending the digits. Our clinical aspect would be lateral epicondylitis, which is commonly referred to as tennis elbow. And it's normally an issue primarily with extensor carpi radialis brevis, and it's actually tears in the tendon that attach to the lateral portion of the humeral epicondyle. As mentioned before, the radial nerve seen here innervates the brachioradialis. It also is responsible for innervating all the muscles in the posterior compartment of the forearm. Quickly, I'd like to mention the anatomical snuff box, which you can see here, which is useful for finding the radial artery within the hand, as well as it's delineated by, on the palmar side, the abductor pollicis longus and the extensor pollicis brevis, these two tendons here. Towards the more dorsal side, or the dorsum side, you have extensor pollicis longus, where you can see here, creating the triangle, or the anatomical snuff box.
And quickly, I just want to mention some of the muscles in the palm of the hand. It's best to think of these in sort of compartments. So here, this meaty muscle group on the thumb is called the thenar compartment. It's composed of 3 muscles. You have your abductor pollicis brevis, your flexor pollicis brevis, and an opponens pollicis. And just like the names say, one abducts and one flexes and one does apposition. Then you have your hypothenar compartment on the other side going to the pinky here. And the names are pretty much exactly the same. You have your abductor digiti minimi, your flexor digiti minimi, and your opponens digiti minimi. And a lot of those muscles originate from some carpal bones, and they all insert on either the proximal phalanx of the thumb or pinky, or the metacarpal of the thumb or pinky. And Just a few more muscles. They are deep to a lot of these flexor tendons, so the only way we could get to them is if we were to cut these, and then we wouldn't be able to show you any of the flexors. But you have a group of muscles called the lumbricals. You have 4 of them. They originate in between the fingers, and what they do is this motion here. So they flex the MCP and expand the digits. You have your palmar and dorsal interossei muscles, and those are really deep, and those are involved for the movements like this. And like we said, the ulnar nerve innervates pretty much all of these muscles, except the median nerve does the thenar compartment and the first and second lumbrical. Everything else is the ulnar nerve.